Today, we're going to review the proper procedure for preparing medications for a leave of absence, or LOA. Following these steps helps ensure medications are prepared safely, documented correctly, and transferred according to MAP requirements. The first step in the LOA process is to print the LOA form using iCentrix and populate all medications that the individual is ordered to take, including any special instructions for use. Review the leave details carefully and confirm the individual's departure date and time, return date and time, destination, and who will be responsible for administering medications while the individual is away. Next, compare the information on the LOA form with the physician orders. Verify that each medication is active, the dose is correct, administration times match, and there have been no recent changes. Never prepare medications based solely on the pharmacy label. The physician order is the source document and must match the information listed on the LOA form. Once the orders have been verified, determine exactly how many doses are needed during the leave period. Only send the amount of medication needed while the individual is away. Be sure to account for all scheduled administration times that occur during the LOA. If PRN medications are ordered, determine whether they need to be sent and whether the responsible person already has an available supply. After determining the quantity needed, gather the medication containers and medications that will be sent home. Prepare one medication at a time to reduce the risk of errors. Never mix medications together in the same container. Each medication should be packaged separately and clearly labeled. Each container must include the individual's name, medication name, strength, dose, administration time or times, special instructions, quantity sent, and the date prepared. Take the time to ensure labels are complete and legible. The person administering the medication during the LOA will rely on this information to safely administer the medications. Be sure to include any special administration instructions. For example, if a medication requires a blood pressure check before administration, those instructions should be written on the container and referenced on the LOA form. Any medication parameters, monitoring requirements, or special directions should be clearly communicated. As medications are packaged, double check that the correct quantity has been prepared. Many medication errors occur when too many or too few doses are sent. Taking a few extra moments to verify the quantity can prevent problems during the individual's leave. Countable medications should generally be prepared last because they require additional documentation. Once the medication has been packaged, staff must document the amount sent home in the count book. Record the date, indicate that the medication was removed for an LOA, document the amount on hand, the amount sent, the amount remaining, and sign the entry according to policy. After all medications have been packaged, complete the documentation section of the LOA form. Staff who prepared the medications must print their name, sign, and date the form. For LOAs lasting less than 72 hours, MAP certified staff may prepare and package the medications. For LOAs lasting longer than 72 hours, medications must be packaged by the pharmacy. Staff are still responsible for completing the LOA form, but should indicate that the medications were pharmacy packaged and document the pharmacy name where required. If a second MAP certified staff member is available, they may review the LOA form and package medications for accuracy. Although a second review is not required, it is considered a best practice and can help identify errors before medications leave the program. The next step is to document who is accepting responsibility for the medications. Record the name of the individual receiving the medications and obtain their signature acknowledging receipt. This may be a parent, guardian, family member, or another person responsible for medication administration during the LOA. Before the individual leaves, Review all medication instructions with the person accepting responsibility. Explain administration times, special instructions, and any monitoring requirements. Encourage them to ask questions and ensure they understand the information provided. Once the review is complete and signatures have been obtained, make a copy of the completed LOA form. One copy should accompany the medications and be provided to the responsible person as a reference. The second copy should be placed in the medbook. Remember that LOA documentation should always be completed in real time. Do not pre document future LOA days. If the individual returns earlier than expected, pre documenting could result in inaccurate records. Real time documentation ensures the MAR accurately reflects the individual's status. When the individual returns from the LOA, staff should confirm that medications were administered as ordered and address any questions or concerns regarding medication administration that occurred during the leave. Finally, remember that medications should never be returned to the program from an LOA. They should never be administered and must never be returned to stock. Any extra medication should either be disposed of according to agency and DPH requirements or remain with the family for future use. Maintaining the integrity of the medication system is an important part of medication safety. Following these steps helps ensure that medications are prepared, documented, transferred, and accounted for properly during a leave of absence. If you have any questions regarding LOA preparation, packaging, documentation, or MAP requirements, please contact your MAP consultant. Thank you.